Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know that I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. For paid online consultation, you can WhatsApp on 922-6810-630. My dear friends, we are discussing the different health problems or the diseases and Ayurvedic perspective regarding that particular condition. Today we are going to discuss rheumatoid arthritis and Ayurveda. Before starting the actual, what you can say, the condition, let me clear you that in my medical practice, I have seen the three important types of arthritis. In the childhood, there is a rheumatic fever. In the middle age, from 25 to 45, there is this particular condition, that is rheumatoid arthritis. And in the old age, we have the osteoarthritis. In Ayurveda, personally, I and many scientists, they compare Vata with rheumatic fever. That is the problem in the childhood. We are also having the separate video for that matter. This rheumatoid arthritis is the middle age problem and the old age problem. This rheumatoid arthritis and gout are categorized in Ayurveda as a Vata Rakta problem. And the old age problem, that is osteoarthritis, is mainly Vata predominant problem. Of course, whenever there is a disease, the involvement of the other doshas are also there. They are associative, what you can say, the bioenergies, disturb bioenergies. Rheumatoid arthritis, as I have said, that it is a Vata Rakta problem. So naturally, Pitta vitiation is there. And that's why whenever you are suffering from rheumatoid arthritis, you should try to avoid the Vata disturbing food and lifestyle, and also the mainly Pitta disturbing food and lifestyle the patient should avoid. Another problem with rheumatoid arthritis is that it is cannot be said that it is 100% curable disease with any pathy, not with the modern pathy, not with the Ayurveda, not with the homeopathy. Then what we can do? We cannot cure, but we can definitely control this particular disease. And what is meant by control? In rheumatoid arthritis, this joint pain, swelling, inflammation is having the phases. Sometimes there is a exaggeration, exacerbation of all these problems, and sometimes there is a very little or no pain at all. This is also a particular stage, and this is called as a remission phase. So relapse, that is exacerbation, and going out, that is a stoppage of symptoms, is also one of the phase. I personally call it as a good days and bad days in the life of the patient of rheumatoid arthritis. Now, what Ayurvedic treatment is doing? Ayurvedic treatment is improving or increasing the good days and lessening or minimizing the bad days. That means with the Ayurvedic treatment, you can control the intensity of the symptoms, and also you can reduce, or you can rather lengthen the recurrence of that particular problem. We will discuss in detail about rheumatoid arthritis, don't worry. But basically, what are the differences? That in the childhood arthritis, rheumatic fever, there is a post-streptococcal infection. So that is an infectious problem. Rheumatoid is an autoimmune disease. Your immunity is get disturbed. And for that matter, anti-Pitta Kaishor Guggulu or Amrutadi Guggulu, this is the best tablet. If in the beginning itself, when your RA blood test is positive, there are sometimes seropositive cases as well as seronegative cases. But with the symptoms, we can diagnose. For example, here the metacarpopharyngeal small joints are affected. Morning stiffness is very common. Symmetrical involvement. Whenever there is a right metacarpo or hand joint problem, left hand joint problem. right elbow, right shoulder, left shoulder, in that way. So you can understand. We will discuss all the things in detail. Another important decoction is a kokilaksham kwath, which is useful for the rheumatoid arthritis to control the symptoms. Rheumatoid arthritis is an autoimmune disorder of connective tissue which produces pain, redness, swelling, and often hit, especially, remember this, in the small joints, metacarpophalangeal joints, metatarsophalangeal joints, wrist joint, then elbow joint, then shoulder joint. These joint affections are symmetrical. Morning stiffness is very predominant. Muscle wasting and inflammation around the joints are very common. Generalized osteoporosis is seen in many cases, so bones become brittle. Serum RA test becomes positive. But remember, there is also some cases RA test is negative, but still rheumatoid arthritis is there. Those cases are called as a seronegative cases. Other possible symptoms are fatigue, malaise, and low-grade fever. If rheumatoid arthritis, which is popularly known as RA, the affected joints may become deformed. Rheumatoid arthritis can affect people of any age, but middle age is very common. Most begin with the 20s and 30s. According to Ayurveda, all doshas are one or the other way involved, but mainly pitta vitiation and blood problem is there. When vata association with the pitta is there, pain will be throbbing, migrating, cutting, relieved by local fermentation. Remember, whenever there is a vata, because vata is a cold in nature, property is cold, so local fermentation. Not for all patients of RA, fermentation will be helpful. Deformity of the joint is more likely whenever vata association is there in RA. Other common symptoms because of vata are constipation, gas in the stomach, nervousness, and insomnia. Rheumatoid arthritis, RA, is basically pitta problem and blood problem. So when pitta aggravation, the joints are inflamed, red, hot to touch, usually accompanied by fever, thirst, and irritability. Very less there is a association of kapha. But if pitta is associated with kapha, there will be more swelling and edema than inflammation. This pain, kapha pain, will be dull and aching, and this can be relieved by local fermentation. So vata association, kapha association, yes, fermentation will be helpful. Now, rheumatoid arthritis, we will discuss first with the vata association is there. What we can do in vata association to ease the pain due to vata, take Guggulu, Galangal, and Dashamula, 10 roots which work against the vata, and Punarnava, 100 mg twice a day. One can take 250 mg Ashwagandha root powder twice daily for 1 month. If anybody wants to use the Western herbs in the European countries, take 1 gram of the black cohosh root or prickly ash bark, 250 mg twice a day for 1 month. Take 1 teaspoon of castor oil, which is very specific for vata, evening for 2 weeks. Now, for the vata, the best medicine in rheumatoid is a Maha-Yogaraj Guggulu or tablet Ruma Yog or tablet Ruma Neel should be started. 2 tablets 3 times in a day. Rheumatoid arthritis with vata association, if pain is very, very high, too much pain, tablet Vata Kulantak or tablet Vata Vidvamsa Rasa, 2 tablets 3 times in a day can control this pain. To make a tonic to the Vata, Ashwagandha Churna, 1 TSF with Balarisht 4 teaspoons with equal amount of water 3 times in a day. For Vata, the best treatment is Basti or the Vasti, that is the medicated oil enema. Always use the Anuvasana Basti with sesame oil. Then for Vata associated with Are, massage the affected joints with Sahacharadi oil and also fermentation with vapor medicated with basil. For fermentation, steam of diaphoretic herbs like camphor, eucalyptus, mint, bayberry can also be used with the shamula. Now we will discuss about RA and having Pitta predominance. Whenever there is a Pitta is having hot and penetrating. So cold application or ice packs to reduce the acute inflammation of the joints. Then for massage also, cooling type of the oils like sandalwood. In India, we use Chandana Bala Lakshadi oil. Chandana is a sandalwood. Gently massage into the joints daily or application. I can say whenever there is acute inflammation, do not rub the oil. No harsh massage is expected. Now, inside internally, aloe vera, curcuma, berberis, and guduchi will be the herbs of choice in rheumatoid with pitta. Optimal formula is Amrutadi Guggulu, 2 tablets 3 times in a day. By the by, my dear friends, I have done my post-graduation MD with the topic of this rheumatoid arthritis clinical trials with Amrutadi Guggulu. And I found the results are very fascinating and very promising if the treatment is started very early before giving any steroids. Because many of the patients afterwards, in modern pathy, rheumatoid arthritis, the patients are given tablet Visolon, which is a steroid. This is, of course, the good to control the acute condition, but in a long run, steroid medications are having lot of complications. Simple complications of steroid medication is hypertension, diabetes mellitus, osteoporosis, peptic ulcer, etc. To avoid the use of steroid, please start Amrutadi Guggulu, not only 2 tablets. In acute condition, you can use 4 tablets at a time. 4 tablets in the morning, 4 tablets in the afternoon, 4 tablets in the evening with Kokilaksha Kadha or the decoction. Now, we will discuss rheumatoid arthritis and Kapha association. In Kapha, Kapha is a cold, Kapha is a cool. So, 3K2, mustard, cynin, calamus are ideal for the Kapha. For external massage, again, hot oils will be useful because Kapha is a cold. Mustard oil, Saptaguna Taila, Prasarini Taila, Nirgundi oil are indicated in RA with Kapha association. If the pain and swelling is too much, one can use Maha Vishagarbha oil for massage. Dry fermentation, because Kapha is there, Kapha is oily, so dry fermentation by infrared rays or sandbag is beneficial. For the RA, one has to practice the yoga for detoxifying ama. Start with Vajrasana or Anulom Vilom Pranayam. Then afterwards, when ama is reduced, Go Mukhasana, Halasana, and Uttana Mandukasana can be practiced under the guidance of yoga teacher regularly. My dear friends, as you have seen that many conditions we are discussing, but if anybody of you are suffering from any health problem, do not hesitate to take the paid online consultation from expert team of the doctors of Ayurveda Academy by just WhatsApp on 922-6810-630. Now the disclaimer, this is an information video, so take the advice of your physician or the doctor whenever and whatever you want to discuss about your health problem. Now, I request all of you, please like this video, share this video, and to get the notification of such type of interesting videos, please don't forget to subscribe my YouTube channel. Thank you very much, and we will see you in the next video. Thank you.